My name is Dr. Frank Vicini. I'm a radiation oncologist working for PrecisCa. I predominantly treat breast cancer in the United States. Been involved in research and protocols for about 25, 30 years now. There can be differences in side effects between accelerated partial breast irradiation and external beam techniques, that is, techniques to deliver whole breast irradiation. To understand them, let's talk about what is the definition of accelerated partial breast irradiation. What it really is instead of delivering radiation to the entire breast, we're delivering it only to the lumpectomy cavity, plus those tissues immediately surrounding it. The idea being that if a patient undergoes a local recurrence after lumpectomy, they're most likely to recur in that region. So the idea being, well, maybe we can deliver the radiation therapy faster by only focusing the radiation to those tissues. And so you can, in effect, accelerate the radiation from the typical 6 weeks in the past to anywhere from one treatment of accelerated partial breast irradiation to more typically being delivered in a week. So the side effects by delivering the radiation therapy can be a little bit different because it's done quicker with partial breast irradiation. You might run into a little bit more acute toxicities such as skin reaction. And it also depends upon the partial breast irradiation technique that you're using. You can use either brachytherapy or external beam radiation therapy to deliver partial breast irradiation, but it more relates to how much is delivered each time over what period of days, whether it be, as I said, 1 day or 5 days. But the important point to remember is in the prospective randomized trials that compared accelerated partial breast irradiation to whole breast irradiation, there are now 8 published phase 3 trials, and all those trials show that in each clinical scenario, that is stage for stage, the long-term toxicities of partial versus whole breast irradiation are very similar. In fact, in some studies, they're a little bit less with partial breast irradiation. But that being said, there are certain things that have to be taken into consideration depending upon the partial breast irradiation technique. If one uses brachytherapy, you need to be concerned about the particular device that is being used, whether it's interstitial brachytherapy, and take into consideration some of the differences in the dose deposition because it's brachytherapy. Same thing with external beam radiation techniques to deliver partial breast irradiation. So overall, done correctly, there shouldn't be any long-term differences in side effects, maybe a little bit more acute side effects with accelerated treatment, but certainly the long-term side effects should be the same. And as I said, in the published data, looking at this very issue now with 10 years of follow-up in literally 10,000 women or more, we've not seen significant differences in toxicity. Still, one should follow the guidelines for the delivery of partial breast irradiation, but nonetheless, in terms of advising our patients, there shouldn't be any significant differences in toxicity.